So we're just going to help patients today in this video developing and combining muscles of the stomach and some muscles of the legs and hips. So this could be used in some lower back pain conditions, and your physician will tell you whether this is appropriate or not. So we need to make sure that we can sit slightly taller. So I don't want my back down, I want my chest up slightly. I want to be able to squeeze my stomach with tension, and I can feel my muscles working. If you aren't able to really control these, or it's been a really long time since you've trained, an easy way is to gently touch your lower stomach and cough. You can feel that pressure. Try and strive to have the same muscle tension when you squeeze your stomach and make your stomach hard as the cough. It's an easy self-check that you can do on your own. So if we're adding hip muscles and or groin muscles, we can use bands. You can use the band around the knees and bands around your ankles. They do different things. So I'll sit in that position, I'll get my tummy firm and tight, and I keep my stomach tight throughout the exercise. I then increase the tension of the band, and I push past that tension, slowly back in. I never go too far to lose the tension. So roughly kind of chest, mid collarbone is kind of a decent tension. Then I'll increase that tension to my shoulders and go back. It keeps these bum muscles working on the outside. So my hips are actually doing this. Okay, so they're actually opening more like that. So that's the first exercise. I can change the location of the band. The band goes down to my ankles. My hip's actually going to now rotate. So when I do that movement, it's actually a rotation of the hip. It's a different set of muscles in the hip. Sit tall, keep the tummy tight. You can do one leg at a time and rotate one leg out. Then you can alternate and rotate the next leg out, or you can lift them off the ground if your back pain or hip pain allows, and open them simultaneously. Okay, I will start with one leg on the ground. It's a safer position for most back conditions and hip conditions. So we've done opening of the knees, opening of the ankles against resistance using a band. You can use different resistances. They're basically just different thicknesses, and normally that'll be prescribed to you. If we're going to close legs, we can use a rolled up towel to start. Doesn't cost us anything. We roll it up nice and tight, fold it between. We sit nice and tall, and I squeeze my tummy. I'll then close my knees against the object. You could have a soccer ball, rugby ball, 20 rand checkers or pick and pay ball. Okay, and I hold it for time. I then release. Again, instead of closing at the legs, which uses my groin, I'll put it by my feet. I can keep my feet on the ground, which is again a safer place to start. Once you're stronger, you could lift them up slightly. Okay, so I keep my legs on the ground, I squeeze my tummy, keeping my back position fairly straight, and I close my feet. Again, that's going to cause more of a rotation in my hips in the opposite direction. So when the band was there, my hip would rotate this way. When I'm pushing against, my hip will go that way. So now I'm working all around the hip joint. Because I'm doing it while keeping my tummy tight, my body learns to do everything at once. Okay, I hope this helps you guys. Cheers.